I was a college athlete. I had actually hurt my back before my senior year of college. I kind of struggled through that all the way through my senior year. Once I got into my 20s, I noticed that kind of my physical activity kind of just slowed down, which I mainly attributed to the fact that I wasn't as active as practice and games. But at that point, I also noticed that, some aches and pains were starting to settle in. Progressing through my 30s, I started to notice after I had my second child that ache kind of turned into more of a constant ache. Once I got into my late 30s and early 40s, that constant ache started to turn into more of an intense, constant pain.
Treating back pain has always been a very difficult part of spine care. Is it something that can be operated on? Is it something that people can rehab their way through? And that's what we would prefer to do, treat people without doing surgery on them or treat people as conservatively as possible. Surgery isn't always the answer for chronic low back pain. And there are some new techniques and devices that we can use to treat them and have been very successful with that. These patients have very little pathology in their back, meaning they don't have a identifiable source per se that would require surgical treatment. So they've tried physical therapy, possibly chiropractic care, medications, maybe even acupuncture. Reactivate works in such a way that it is restorative and that it helps rehabilitate the spine rather than destroy tissues or nerves that might be the source of the pain. So this is a very interesting and exciting time, I think, for treating low back pain with this new device.
I was excited to actually have something that was an option. It gave me hope. They're actually saying that there's a possibility that this is going to help fix this pain.
What these patients typically are suffering from is an atrophy of the multifidus muscle. And this device actually stimulates the multifidus muscle to contract twice a day to rehabilitate the spine. And it's been very successful in relieving back pain. And we've been very encouraged by the initial studies that we've done with this device, which is called Reactivate. The implant itself is an outpatient procedure that's done under anesthesia where we implant electrodes onto the medial branch nerves that stimulate the multifidus muscle. Now, these electrodes are attached to a generator, a small battery device that's implanted underneath the skin, and the patients have a program that they use to activate it.
Since I've had the procedure, I'm doing more now in my 40s than what I was doing in my 20s. Even being an athlete, I feel I am way more active now. I work a very physical job, so there's things that, I'm up and moving and bouncing and, in between, doing 15 things at once, and nothing stops me, nothing slows me down. I feel I'm better now than what I was, like I said, in my 20s.